Welcome back, future nurses. I'm Dr. Kathleen Jude Estime, and I'm a psychiatric nurse practitioner, and I'm on my journey to become a certified nurse educator. Today, we're tackling respiratory on the NCLEX scenarios, one of the crucial areas you must master. And remember, whether you're studying with Professor Leandre's NCLEX coloring books, our digital products, or joining my tutoring sessions, you're building confidence until you pass. All right, Professor Leandre, question number 1 is critical thinking and safety. A client presents with shortness of breath and wheezing after using their asthma inhaler. What's the nurse's very first priority action? Do we listen to the lung sounds, administer oxygen, or assess vital signs first?
Pause and think. Do we listen to lung sounds, administer oxygen, or assess vital signs first? Always remember, client respiratory status is priority 1, okay? Immediate assessment and intervention can be life-saving.
Question 2, therapeutic communication. A client with COPD expresses frustration saying, "I can't breathe," and feels hopeless. Which nursing response is most therapeutic?
Hint, offer support and validate their feelings without minimizing their experience or providing false reassurance. Therapeutic communication remains essential on NCLEX. In my coloring books, I provide scenarios to help you practice these skills.
Question 3, medication. Your client diagnosed with pneumonia is prescribed erythromycin. What side effects should you monitor closely?
Think about potential gastrointestinal issues and signs of allergic reactions, such as rash or difficulty breathing. Teaching moment. Medications often appear on NCLEX. My digital resources simplify drug categories and side effects into easy-to-use charts.
Question 4, delegation and scope. When caring for a client on a ventilator, which task can the RN safely delegate to an LPN?
Hint, RNs handle assessments and complete tasks while LPNs can monitor stable patients and perform routine care. Teaching moment. Delegation scenarios are high yield for NCLEX, and I cover them extensively in tutoring to ensure you're confident.
Question 5 is assessment skills. A nurse performs a respiratory assessment. What are the key signs of respiratory distress to observe?
Correct. Look for tachypnea, use of accessory muscles, and cyanosis. Teaching moment. Assessment skills are fundamental and will be tested frequently. Practicing with scenarios help reinforce your learning.
Question 6, complications. A client with a history of asthma is admitted with acute exacerbation. Which complications should you be most vigilant for?
Think about potential respiratory failure and the need for emergency interventions such as bronchodilators. Teaching moment. Understanding complications is vital for NCLEX. My guide includes common scenarios and management strategies to prepare you.
Question 7, patient education. What key teaching point is essential for a client prescribed a peak flow meter at home?
Remember, they should record their readings daily to monitor their asthma and know when to seek medical attention. Teaching moment. Patient education is often tested. I emphasize these topics to help you remember important teaching strategies in my resources.
Hi guys, if you found these questions helpful, don't stop here. You can grab my NCLEX coloring books in a series. Look out for them. Download a digital study guides and sign up for tutoring. And remember, my NCLEX review programs includes weekly TikTok lives and Sunday Zooms. Stay with me until you pass. Visit the link tree in my bio to get started. See you in the next episode, and remember, you've got this.